I do want to start with a brief update of our current status, and I'll take the first slide. Our average daily number, our average daily number of new cases of COVID-19 is continuing to steadily decrease. But you can see here that the line of new cases, and that's the green line, is not quite as steep. And that means that the rate of decrease is actually slowing down. As of February 23rd, the average daily number of new cases by episode date is around 900 new cases. So we've returned to the levels of new cases that we actually saw before the surge at the beginning of November. And so far, it does look like the Super Bowl weekend did not have an impact on our numbers. But we'll need to wait a few more days to assess the impact of the February holiday weekend. As our cases decline, we're also seeing the average number of people who are hospitalized for COVID-19 decline as well. And you can see that on here with the orange line, though we're not back by any means to our pre-surge levels. Our daily hospitalizations are now at about 1,500 patients hospitalized each day with COVID-19. But if you look on this chart, you can actually see that in early November, our daily hospitalizations were at about 800. The 7-day average number of daily deaths also continues to decline, and that's our blue line. But unfortunately, this number remains, as you can see, far too high. The number did peak at 254 deaths on January 13th. But unfortunately today, and for many days these past weeks, I've reported over 100 deaths a day. And as a reminder, in early November, the average number of daily deaths was around 14. So it's our hope that as hospitalizations decrease, we will witness less people dying. And the continued high number of people passing away each day is a heartbreaking reminder that this pandemic is far from over. And we need to continue our diligence in masking and distancing whenever we're around others. As families may now be making plans for spring break, please consider staying local and enjoying the beautiful outdoor spaces across the county, our parks, our beaches, and our trails. We should continue to avoid travel and gatherings, especially those that are happening indoors. These activities led to devastating consequences over the winter break, and they can easily set us back on the progress we're making to slow the spread. And as you can see with this new slide, we've updated on Tuesday the state metrics that measure COVID-19 transmission in the county. And LA County remains in the purple tier because our transmission or our case rate continues to indicate that we have widespread transmission. But our adjusted case rate has now dropped to 7.2 new cases per 100,000 people. And that means we're getting very close to reaching the red tier threshold for this metric. Our 7-day average daily positivity rate already has dropped significantly, and it's now 3.5%. That means out of every 100 people that get tested, less than 4 people are testing positive. And this other rate, which is called the positivity rate in the lowest HPI areas, this is really a measure of how we're doing in the communities that have the least number of health affirming resources. And even there, our rate has dropped dramatically, and it's about 5%. For both of these metrics, the county is in what we call the orange tier. But as a reminder, we are placed in the most restrictive tier for any one of our measures. So given that we still have a measure in purple, we remain in the purple tier. But it is possible, given the low number that we're seeing on the case rate, that we could move into the red tier as early as March 17th. Our case rate would need to remain at or below 7 new cases per 100,000 residents for 2 consecutive weeks to be eligible for reopenings that are allowed in this tier. But it's our estimate that if we continue to make progress both next week and the week after, our case rate should be at or below 7 new cases per 100,000. I do want to go on to the next slide and talk about vaccine equity. And I want to spend a couple of minutes trying to discuss where we are on our vaccine strategy. The first note and the most important is that we've built with our partners a very extensive network of vaccine sites all across the county. And you can see on this map that this is where people can get vaccinated this week. And there are over 500 places where people can get vaccinated in LA County this week if you're eligible to get vaccinated. And those people that are eligible include any resident that's 65 and older, any healthcare worker that works in LA County, any resident of a long-term care facility, any worker that works in agriculture and food, that works in childcare and education, and that works in law enforcement or emergency services. In total, that's about that's well over 2.2 million people that are currently eligible to get vaccinated. And when there are appointments, people who are eligible can go to any one of these sites. And you'll notice that because we have lots of different dots here, that it really stands for the different kinds of sites where people can get vaccinated. So I want to start by acknowledging that we have federally qualified health centers and community clinics that are offering vaccinations at 153 places across the county. We have 121 pharmacies where this week you can get vaccinated in the county system, and another 100 pharmacies that are in the federal system where people can get vaccinated. We have dozens and dozens of hospitals that are offering vaccinations. And we have what we call our community sites that are both large and small community sites where people can go and get vaccinated. Again, some of those are run by LA City. There's one site that's run by the federal government, and 7 sites that are run by LA County. I'll take the next slide. I also want to acknowledge that although we have a very widespread network, and as you could see on the map, we have vaccination sites in every community across LA County, we also unfortunately have a sad reality that people in LA County are not all easily able to access vaccines. And you can see that on this map. Those communities with the darker colors have the higher percentages of people 65 and older who are residents in LA County that have been vaccinated. And it's glaring to note that in South LA, Southeast LA, parts of the valley, San Gabriel Valleys, parts of San Fernando Valley, and up in Antelope Valley, we have what we're now calling our vaccination deserts. And these are deserts because people living there are still not vaccinated at the same rate that people are vaccinated in other parts of the city. So I'll take the next slide. So we have a lot of work that we're going to need to do to address these inequities. And it is both a challenge and an obligation for us to solve this problem and solve the problem quickly. So I just want to give you an idea of some of the ways that we're working to improve access for people in hard-hit communities. Because one thing for those of you who've been watching the pandemic's history that I'm sure you realize is those communities that were the lighter color communities, those communities that really had the lowest rate of vaccines, are in fact the very same communities that have the highest case rates, the highest rates of hospitalizations, and so sadly, the highest death rates. So since vaccinations adds an extra layer of protection, in those communities that have been the hardest hit, and among those people that have suffered the most, we have to do a much better job making sure that they're getting vaccinated. So one of the things that we're doing right now is we're partnering with community-based organizations, community leaders, and our call center to be able to register individuals in under-vaccinated communities for appointments at the county sites and our public health clinics. And we held back 2,000 appointments this week that didn't get made available publicly so that we could use our partners to actually sign people up, and then we'll register them when they get to the site into the state's registration system. But this is another way to make sure that appointments are more easily accessible to people who cannot stay in front of the computer all day, watching to see when appointments open up. or may not have computers to start with. Again, trying to sort of narrow that gap that we see. That's the unfortunate reality of who's got time and technology that at this point advantages you in making appointments. We're also increasing our mobile teams. This week we had 46 sites where we were vaccinating. Again, these are places where our team shows up at the site with the curative folks. People who are living at those sites are eligible to come and get vaccinated if they want to. There's no pre-registration that's required. We're doing senior housing developments right now because we want to address the fact that many seniors have limited mobility, and that again shouldn't stop them from getting vaccinated. And most of our mobile teams are in the hard-hit communities at the senior sites in the hard-hit communities. We also acknowledge that some people, they'd like to get an appointment at one of the other sites that are open, but they need help with transportation. And for that, we're actually working with our partners. This week, we released about 1,500 Uber round trip rides. And those are available both for people going through the call center making appointments and for people who are making appointments at federally qualified health centers. We're going to continue to work, and the Supervisor Solis has been a huge champion of making sure that we address transportation barriers. So we're going to continue to work to offer more options to help people get to the sites that are open for vaccinations. We also, while we do need to make sure people are eligible for getting a vaccine when they fall into one of the eligibility groups, we don't want to say that having to show your verifications is so hard that even though you're eligible, you can't get past that threshold. So we have many different ways that people can verify that they're eligible for getting vaccinated now. This is especially important for workers in food and agriculture, for our childcare workers. And we want to note that at no point do we ask any questions about citizenship, or do you need to be a citizen or have your green card in order to get vaccinated? There are no sites where you should get asked about your immigration status, and immigration status is not a limiting factor. It's not used for the means test, and all of the information about who's getting vaccinated is considered private and confidential as part of a medical record. So I want to reassure people, please don't let your immigration status stand in the way of getting vaccinated. The information is protected. It's health information. It's protected. And we want to make sure you do get vaccinated. You also don't need a government ID to get vaccinated. A lot of people have confusion about this, and you do not need a government ID. There are all kinds of other forms of verification, and you can go to our website to better understand those forms. Basically, we ask that people can establish who they are, and they can establish that they in fact are employed in one of the eligible work sectors, or that they're a resident here in LA County and are 65 and older. We monitor our data all the time, and we try to make sure you have access to that information as well, because that helps us understand whether or not we're doing our job and doing it well. Who is getting vaccinated is a very important measure at this moment of whether or not we're doing our jobs. We also want to make sure that businesses understand that they need to help facilitate their employees getting vaccinated. And there are many ways that businesses can help. Two big ones are, you can, if you're a large business, you can connect with us. We'll help you identify a healthcare partner, and you may be able to vaccinate your workers if they're eligible for vaccination right there at the work site. And that's a good deal for everyone. But if you can't offer that, then we need you to let your workers go, if they're eligible, to get vaccinated at other sites, and to please pay them while they're going to get vaccinated. We don't want people having to choose between getting paid for work and getting vaccinated. For food and agriculture workers, we have a special site that you can go to ask any questions and get additional assistance. We know that this is a very diverse workforce. There are many different kinds of businesses in food and agriculture, and we want to make sure we're as helpful as possible. I'll take the next slide. But there are some challenges, and I want to make sure that we're honest about the challenges. We're going to continue to try to address these, but they're real. The first is we don't have enough vaccine doses for everybody who's eligible right now. And as you know, we keep adding more and more people that are eligible. And I want to just correct the numbers that I gave earlier because I didn't count everybody. So we had 2.2 million people that were eligible amongst healthcare workers and residents that are 65 and older. We've now added another 1.1 to 1.2 million people. So we actually have about 3.3 million, 3.4 million people that are currently eligible in LA County to get vaccinated. That's a very large number when you know that we've only received about 2 million doses to date. And it's going to take over 4 million doses it's going to take over 6 million doses to vaccinate everybody who's currently getting vaccinated, because we're using 2-dose vaccines at this point in time. So we've got a ways to go to make sure that everybody who's currently eligible can get vaccinated, but we're doing our very best to make sure that we are prioritizing those that are eligible and those that are in the hardest hit communities and are eligible, because that's where you can see from our data, we have a lot of work that's important to do. I do want to note that we use a state appointment platform as where people are supposed to go to make appointments. And we want to acknowledge that, again, it's web-based. So for people who don't have easy access to computers, don't have a computer at all, don't have internet, that appointment platform isn't going to work for them. And because of that, we set up the call center. We also want to acknowledge that it's not really able at this point in time to offer the flexibility that counties like ours need to restrict who's able to get appointments. So if we wanted to restrict, for example, appointments at the forum to people who live around the forum, we can't do that through the appointment scheduler yet. But we've asked them to work on that because it's really important. If you want to have a strategy that really prioritizes some communities and you have an appointment system that doesn't allow for you to set those priorities, it makes it more complicated. But I know the state is working hard with us to address the concerns and really help us do a better job with our equity commitments. We also have a lot of folks that are in our network, and we're so grateful for every single partner. But some of our partners are small partners. And in order for them to expand their capacity to vaccinate, they need resources. So we've asked in a lot of our partners, and we want to make sure for the smaller partners, the partners that are, have been in our hard-hit communities before the pandemic, during the pandemic, and they're going to be there long after the pandemic. If they need additional resources to help expand their ability to vaccinate, we need to find those resources and make sure that they're able to get those resources. They're such valued partners, but I want to say for some of this work, it is going to require additional resources. And then I want to note that we are trying, every day to coordinate with our federal partners, our state partners, and our local partners. And that too is a challenging task. So sometimes, we do have to ask for your patience as we work on our guidance, as we work on our documents, as we work on rolling out new strategies, because we have to talk to a lot of people to get this right. I think what's really encouraging is that amongst our federal, state, and local partners in government, we have a shared set of values now with a new administration, and everyone is deeply committed both to equity and getting vaccines into the arms of the right people as quickly as possible. So I'll take the next slide. And in closing, I just want to sort of amplify again what Supervisor Solis mentioned earlier, which is how important the Community Health Worker Initiative is. We've actually been using community health workers, both full and part-time community health workers, since October. So I want to thank every single community health worker that's been part of this, all of the promotoras, everybody for their contributions. These are trusted individuals. As you can see, they've done over 200,000 outreach activities in our neighborhoods. They've reached almost 400,000 individuals. They've distributed 232,000 masks and 60,000 hand sanitizer bottles as part of their block by block efforts to both inform and answer questions and really listen to how people are doing in our communities, and then pass that information along to the rest of us. So we're anxious to continue working with them. They obviously have a huge role to play as we're moving out vaccination efforts. And I too want to sort of join the chorus that recognizes having trusted and very knowledgeable community workers is making a huge difference in everything we're